to take over the session. Welcome.
Now, there was a request for discussion on the Sroto Vikar. I think it is a weird Vikar request because whatever we are discussing is on the lines of the Srotas only, but still, because you have asked for it, so we will present the same thing which is already discussed in a different manner. So, there is nothing new in this. Whatever we are discussing is on the lines of the Srotas only, but maybe the terms which are used are somewhat different. Now, as far as the srotas, theoretical part of the srotas is concerned, the concepts of the srotas in Charaka Samhita is quite detailed. And the srotas, according to Charaka Samhita, it's a very fine structure present throughout the body. Yavantha purusho murtimantaha bhava visheshaha tavanta evasmin srotasam prakara visheshaha. So, there is an innumerable number of the srotas, and every structure of the body has a srotas in, and that means a space in. Without space, nothing can be there in the body. Sarvehi bhavaha purusho nantarena srotamsi abhinirvartante. Without having some space for the movement of the molecules, nothing can occur in the body. So every biochemical reaction where there is a movement of molecules or the finer aspects of that is depending on the srotas. So srotas involves this gross structure to the finest possible space where there is some movement, and the movement being regulated in the physiological context is a srotas. Srotamsi khalu parinamam apadyamanam dhatunam abhivahi bhavanti ayanarthena. So every biochemical reaction, so dhatu parinama is the biochemical reaction occurring in the body, requires some amount of the space for the movement of the molecules, and this space is the finest possible assessed movement of the space is the srotas. Now, at the present situation, the assessment of the space physically is possible with the electron microscope, which can reach up to 0.005 micron. But the concept of the sources even can go beyond that, much more than that. Maybe the capacity of the electron microscope may have to be enhanced further, but still it's an infinite limit. So there is no limit to that finest possibility of the space in the biochemical reaction, and whatever we now identify is limited to what the electron microscope can see. Beyond that, it's only the perception. Whereas in Charaka or Sushruta, it is limited to something which is visible to the naked eye, and only the current science has extended that limit from the whatever is visible to the naked eye to the electron microscope visibility. Maybe the technology in due course of time can go ahead further, and the concept of the srotas or perception of the srotas may vary. So whatever we know is not definitely final, but we perceive the whole body in a sort of assessment of the systems, and that relates to the gross srotas as such. अपि च एके स्रोतसामेव समुदायं पुरुषम् इच्छन्ति सर्वगतत्वात् सर्वस्वतत्वात् च दोषप्रकोमणप्रशमनानाम्. According to some, the srotas, the whole body is having the srotas, and because it is present throughout the body and it is a biochemical reaction. But this kind of a perception would become somewhat very difficult to perceive. So hence, to make it convenient and practical, it is limited to the gross visible srotas. न तु एतदेवं यस्य स्रोतांसि यच्च वहन्ति यच्च आवहन्ति यत्र च अवस्थितानि सर्वं तद् अन्यत्येभ्यः. The material which is moving in the srotas is different from the srotas as such. Like when we say the gastrointestinal tract, the food which is moving in is different from the gastrointestinal tract. Or when it goes to the microcellular space as such, the molecule which is transmitted or the ion which is transmitted across the cell membrane is different from the cell membrane, and this kind of a differentiation may be still possible. See, now you may come to the level of ion, but if you go into the next level, the electron protons which are present in the atom, they too are different from the space there. Suppose something new comes in the technology where there could be some more subparticles which is still possible in the electrons or in the protons, further divisions occur. Then there again there would be the same concept, and this kind of a concept can go on infinitely, and hence it is limited to the visible and countable rather, or perceivable limits as such, and hence what Charaka says is Atimahatvat Kalu, Kechil Apasankhayani Atikshate Srutansi, Parisankhayani Punaranya. There is a difference of opinion, like some of them consider the srotas as innumerable, some may be counted, but there is nothing difference in that. It's only to make it more convenient for the perception that the srotas numbers could be counted. Tesham tu khalu srotasam yathastulam katichit prakaran muladasya prakopavignanascha anuvyakhyasyaamaha ये भविष्यन्ति अलम अनुक्तार्थ ज्ञानाय ज्ञानवतां ज्ञानाय च अज्ञानवतां. For the practical purposes, for the proper knowledge of the physiology and the practice of disease conditions, the assessment of the srotas in terms of the gross functions of body is good enough. So that innumerable srotas concept also is true, but at the same time it's enough for anuktartha jnanaya jnanavata. For those who have that perception of the innumerable, for them even this would be enough. Or even those who cannot perceive that finer aspects, that assessment of the gross even is enough to have a practice as such, and hence the srotas numbers could be limited to prana, udaka, anna, rasa, rudhira, mamsa, medo, asti, majja, shukra, mutra, purisha, sweda, vahaniti. Vatapitta shleshmanam punah sarvasharira charanam sarvani srotamsi ayana bhutani tadvad atindriyanam punah sattvadinam kevalam chetanamat shariram ayana bhutam adhishthana bhutam cha. Now, for the practical purposes, the prana, udaka, anna, rasa, rudhira, these kinds of the assessment where gross substances can be seen moving through, it could be considered as a srotas. Even the excretory substances like mutra, purisha, sweda, also they require a channel, and hence they could be considered as srotas. As far as vata, pitta, kapha are considered, according to Charaka again, there is no vatavaha srotas or pittavaha srotas or kapavaha srotas, because vata, pitta, kapha are present in every srotas there. Hence, vata, pitta, kapha are present in all pranavaha srotas, udakavaha srotas, or so on, every srotas. And hence, when the disease occurs in a pranavaha srotas, you may have a vataja pranavaha srotas vristi, pittaja pranavaha srotas vristi, kapaja, or the combinations like the tridoshaja, etc. Tadvad atindriyanam punasattvadinam kevalam chetanam shariram ayana bhutam nissanam cha. Then when it comes to the question of the life activity, life, Atma. Now, Atma is not a material, but still it requires a space. But that srotas, it cannot be considered as a srotas as such. It is something which is regulating all the movement in the body, and that entity which is considered as Atma, which cannot be described by the biochemical means as such, that concept of the life entity. Now, from the current physiology point of view, the life entity cannot be explained in the same manner as that of the perception from Ayurvedic point of view. All that what we know is, as long as the biochemical reactions are in a dynamic state, active state, we say that there is a life activity. If the biochemical reactions go static, if that doesn't move on, stops, then we say that the life process ends. This is how, maybe in a very gross description of the life entity in biochemical terms. Now, even the concept of the Atma requires the entity of the srotas, because there has to be a movement, then only the sign of life can be seen. Though there is nothing like a Atmavaha srotas or Manovaha srotas, of course that term is used, but it doesn't require that, because it's something which is present throughout. So about the Manovaha, Atmavaha, this is not really a practicable, but though Manovaha srotas word is often described. Tadetat srotasam prakriti bhutatvat vikaraihi upasrujite shariram As long as the srotas are functioning properly, there will be no disease. But if there is impairment of the functions, then the srotas would be affected. Now the perception concept of the srotas in Ashtanga is again slightly different, where it is given some gunas descriptions. Swadhatu samavarnani, vrta sthulani anuni cha, srotamsi dirghani akritya, pratana sadrushani cha, aharascha viharascha, yaschab dosha gunai samaha, dhatu viguno yachcha, srotasamsa pradushakah, अधिप्रवृत्ति संगो वा सिराणां ग्रंथयोपि वा विमार्गतो जवागमनं स्रोतसां दुष्लक्षणम्. Now Vagbhata has left out that finer details of the srotas to a certain extent, and the srotas is limited to what we see as a gross, like the same prana, udaka, navaha, etc. And the physical properties of the srotas are described in Vagbhata in terms of their shape. They are usually elongated, or they may be wider enough to carry the substance which is necessary, or they may be fine depending upon the substance which is being carried around, and it has the same color as that of the substance which is moving in. Like a blood vessel would have a red color, and this bile carrying vessel would have the same color of the bile, and so on. And they have branch-wise distributions, pratana sadrusha. They branch, either branch in or branch out, and the functions of the srotas would be depending upon the quality of the dhatu, and whenever there is a abnormality of the dhatu which is being carried by the srotas, which could be abnormality which could be induced by the lifestyle factors, it also can affect the srotas. And the effect of the srotas could be, the defects which could be produced in the srotas could be ati pravritti sangaha siranam granthayah vimargato gamanam. Now the ati pravritti, excess of secretion, or where the quantity of the secretion could be more, sangaha where the quantity of the secretions which are lesser, siranam granthaha where the structural abnormality like an aneurysm, or maybe this tube may be constricted, stricture, or aneurysm dilatation, these would be the siranam granthi. Vimargata gamanam where the movement is in a opposite direction, retrograde movement of the substances, which are the basic defects. Now the primary question is whether these basic defects of the srotas are induced due to the abnormality of the doshas, or whether the basic defects of the srotas induce the dosha drushti. For this, the answer could be both the ways. A dosha drushti which is produced due to the ahara and vihara can result in abnormality of the srotas. Once it involves the srotas, then the disease process could be permanent. It becomes somewhat irreversible. So that in case of the Shatkriya Kala mentioned by Sushruta, it's again the same issue. Like once it goes into the level of the sthana samshaya, there is a possibility of involvement of the srotas, and once the srotas or the seat of the dosha is affected structurally, then the disease process can become eternal, continuous, and the requirement of maybe a interventional treatment may be required. Till then, there is no need of interventional treatment. If you correct the doshas, then the aggravation or involvement of the srotas, the channel could be lesser. And so this perception again is a very practical perception. That's what we will discuss when we discuss about the disease process, clinical aspects later. This is one of the important points, like how a vitiation of the dosha can result in the different forms of the abnormality of the srotas. Now, Bisanam yo sukshmani duram pravisadancha dvarani srotasam dehe rasau yehi pujiyate. The description in Sushruta. Now, this also is from Vagbhata. The comparison for those who cannot perceive that, Vagbhata has given the comparison of the roots of the water lily plant to the same where there could be fluid. Now, if you look at the electron microscope picture of a cell membrane, this is from a microscopic cell membrane, microscopic picture of the cell membrane, where the channels are seen. You compare these to the bisa, that's the roots of the water plant seen below the water, exactly the same. So whatever is discussed in terms of the description of the srotas, that can be demonstrated with an electron microscopic image. मूलात् खादन्तरं देहे प्रसृतं तव्यवहेतु स्रोतस्त्रिविद्येयं शिराधमनिवर्जितम्. Now the Sushruta has given that description. Anything which is extending beyond that main course of the body, main channel of the body, that can be considered as srotas. The srotas in Sushruta is again has been described as something which is different from the Sira Dhamani, but according to some, the Sira Dhamani are considered to be the same. The srotas are mula, and all the srotas which is discussed in Sushruta is mainly related to the gross systemic structures, gross structures which are visible. The finer aspects are not given the equal importance, because after all, from the clinical point of view, those finer aspects have comparatively lesser significance when it comes to the question of intervention. So whenever there is a need for intervention, it is all related to the gross srotas, and hence Sushruta limits them into the gross structures. And there again, instead of going to the theory, it's only about the possible defects which could occur, and hence there is a word called as Mula Vidha. The Sroto, Mula and Srota Vidha, the origin of srotas, or when I say Mula, though the translation is about origin, it may not be really the origin, it's only the regulating areas, controlling areas of that particular system, maybe the considered as Mula. And if there is an abnormality, and a Vidhan doesn't need only traumatic injury, it could be injury due to any of the other factors, even the chemical injury, or maybe the injury due to other physical energy. It can result in the abnormalities of the contents which are present, and the contents which could be produced could be, there could be again same, like either excess of secretion or lesser secretion, the same Ati Pravritti Sangaha, these can occur. Now the number of srotas mentioned in Sushruta are slightly different from what Charaka has mentioned. Prana, Anna, Udaka, Rasa, Rakta, Mamsa, Medu, Mutra, Purisha, Shukra, Artavavhani, Eshu Adhikaraha, Ekesham Bahuni, Etesham Visheshaha Bhavaha. That Artavavaha srotas is something which is added by Sushruta. Now we will not go into that difference. It's simply a simple perceptual difference, so that's not a major issue. We'll try to make it see like how this can be applied from the practical clinical point of view in the present day situation. So we start with the Pranavaha. Tatra Pranavahe dve tayoha moolam hrudayam rasavahinischa dhamanyah. According to Sushruta, the Pranavaha srotas has its major controlling factor at the hrudaya, in the thorax area, and Rasavahini Dhamani, the structures which carry the Rasadhatu. Vidha Tatra Vidhasya Akrosha, Vinamana, Mohana, Brahmana, Vepanani, Maranam va bhavati. Now that's what Sushruta has said. Whereas what Saraka has said is Pranavahanam Srotasam Hrudayam Moolam Mahasrotascha. Hrudaya and the main channel, the core part of the body is the base as such, or is a regulating area. Pradhishtanam tu khalvesham idam vishesha vijnanam bhavati tadyata atisastam, atibaddham, kupitam, alpalpam, abhikshnam, sashabda, shulam, uchchasantam, drishtva pranavahanyasya srotamsi pradhishtani iti vidyata. It can result in various forms of the respiratory abnormalities. Either there could be a bleeding with the secretions at the system, or there could be drying about the secretions, or there could be different abnormal forms of the breathing as such, or there could be abnormal sounds produced during the breathing. These are the signs of the abnormality of the pranavaha. So, looking at this, most of these signs could be seen in the respiratory tract. And from the practical point of view, the word prana, which is related to the vitality, is mainly dependent upon the respiratory system, as far as the confusion or a discussion like whether pranavaha has to be considered as the vascular system or the respiratory system. This kind of a difference is again not much important when you look at from Ayurvedic point of view. From the Ayurvedic point of view, when you say the prana or when you say that oxygen as such, the way you perceive from the aerobic point of view is that the oxygen being carried to the level of the tissue. It's not only the breathing or respiration occurring at the lungs. The oxygen being carried to the level of the tissue is one system, whereas the carrying of the nutrition in the blood is another system, another srotas. Now, whereas from the current perception point of view, when we say respiratory system, it limits to the oxygen being absorbed in the lungs. Beyond that, is not a part of the respiratory system. Carriage of the oxygen is a cardiovascular system function. So, whatever that confusion occurs, the confusion is because of that kind of a perception, which is simply a perception difference, but doesn't make any much significance in the sum. Anyway, for all practical purposes, we consider the Pranavaha srotas as the respiratory structure where the oxygen is exchanged in the lungs plus the oxygen reaching to the target organs and the oxygen being utilized at the cellular space. All these starting from the nose through which the air enters into the lungs and then being pumped through the heart. So Hridaya Moola is from that point of view. The heart also is integrated with the Pranavaha srotas or the function of carrying of the oxygen. Though in the present day situation you consider cardiovascular system separately, respiratory system separately, whereas the perception of a Pranavaha srotas is a integrative functional alignment of the respiratory and the cardiovascular system, which involves both the respiration at the level of the lungs as well as the tissue respiration, and it involves the utility of the oxygen as well as the excretion of the carbon dioxide. So this kind of a perception has to be seen. Now, once you have perceived this, naturally we look at the disease from the current point of view as in relation to the srotas. Now, whatever I am going to present or discuss now onwards is a sort of repetition. Majority of these conditions we have discussed in some other context in a different perception. Now, suppose if we have to analyze the present clinical approach of the organs of the body according to the system, as an example from the Pranavaha srotas point of view, I would start with the Pranavaha srotas as the respiratory system, starting from the nose. Suppose if you look at the nose and then look at the common abnormalities which can occur, again, it may not be possible to list all the abnormalities, some of the abnormalities, and to show the effect of a gradual dosha-drushti involving the involvement of the sroto-drushti. From that point of view, I have just sequenced the disease conditions which we see in the clinical practice with some practical clinical approach as such. Now, the first of the thing from that point of view, we limit one view, one aspect of the respiratory system. The one aspect of the respiratory system, and we start with the nasal mucosa. The nose has many functions. One of the important functions of the nose is to facilitate, make the air utilizable in the lungs by regulating its temperature, regulating its humidity. That's one aspect. But another important aspect of the nose and the nasal mucosa is to prevent any solid or any non-absorbable or something unusual substance from reaching into the respiratory tract, protecting the respiratory tract from that point of view. So I will just focus on that part now. To assess the diseases in terms of the sroto lakshana as such. And from that point of view, the most important protective function of the nose is the sneezing reflex. So sneezing reflex is a normal reflex activity which is produced whenever the nasal mucosa is irritated due to certain substances, maybe either physical substances, material substances or chemicals or so on, and it results in the stimulus of the sensory nerves through the trigeminal nerve, and there would be a parasympathetic activity, and that due to the parasympathetic activity the nasal secretions would increase and lacrimation would occur, and it also affects the motor nuclei, and there will be the stimulus into the voluntary structures of pharyngeal and laryngeal muscles, somatic nerves. Now, it's a very complex reflex where the reflex is initiated by the parasympathetic activity, but it affects ultimately the effect occurs in the somatic nerves and it presents as sneezing. So whether the sneezing is voluntary or involuntary. It's primarily initiated as a involuntary, but it occurs as a voluntary activity. Now that kind of a reflex is a protective reflex in the body, and it's quite normal to have a few sneezings in a day whenever you exposed to the dust or whenever you are exposed to some irritant substances. And that's exactly what Sushruta has described as a तीक्ष्णोपयोगात् जिघ्रतो वा भावान् कटून् अर्कनिरीक्षणाद् वा सूत्रादिर्वा तरुणास्ति मर्मणे उद्घाटितो अन्यः क्षवतुः can be induced due to this use of some irritant substances or smelling irritant substances or smelling some katurasa, pungent taste substances, or by looking at the sun, or maybe due to the physical substances like thread or so on. When the marma are affected, the sensory areas are affected, it produces a reflex. So a sneezing once or occasional or whenever there is a specific cause is not a disease, it's a normal reflex activity. But if the same occurs in a situation where it can become progressive or it can become persistent, when either the stimulus has resulted, these repeated exposure to the stimulant have affected the sensory mechanism of this whole complex mechanism, any of these components of the complex mechanism which we have mentioned, like nasal mucosa, or it could be the sympathetic nucleus or what we call as a sneezing center in the medulla. If any of these, their functions are affected, that results in a persistent sneezing, which is considered as a disease, sneezing reflex. Very commonly, we see it in the allergic rhinitis-like condition, patients who have a sneezing which is much more than normal. From the current point of view, if you sneeze more than 12 sneezes within 1 hour, and if it is persisting continuously for more than 3 weeks, then it is considered as a abnormal sneezing reflex. Anything below is not considered as abnormal reflex. That's how it's standardized, that sneezing disease, a condition which results in a disease of the sneezing or which requires some intervention, is defined as that way. More than 12 sneeze effects in an hour and which is persisting for more than a month, then it's considered as abnormal, which requires intervention. Anything below that, it could be something where it is considered as a factor which is related to maybe the living, or maybe there could be some real specific causes, or it is considered as a protective phenomenon which doesn't require the treatment. Now, majority of the patients whom we see with the sneezing reflexes are produced due to the allergic pathology, hypersensitivity reactions, which could be due to certain substances, or which could be even due to the hypersensitivity to some food substances. But the same, it can occur in endogenous. There could be 2 reasons which can become very persistent. Could be one, if there is a inflammation of the nasal mucosa and the exudates of the nasal mucosa would be continuously discharging through, and then it's called as a भ्रंशतु. प्रभ्रश्यते नासिकैव यश्च सान्द्रो विदग्धो लवणः कफस्तु प्राक्सञ्चितो मूर्धनि पित्ततत्त्वः तं भ्रंशतुं व्याधिम् उदाहरन्ति. The भ्रंशतु is due to the inflammatory exudate which is produced in the nasal mucosa area, and due to continuous dripping of these, which we call as a post-nasal drip. One of the changes in the srotas due to the initiating factors which could be related to the food or maybe due to the exposure and so on. Now, a patient presenting with only these allergic phenomena, the whole condition can be prevented or cured if you identify the causes. If there is a possible identification of the causes, it can be managed and there is no need of any specific treatment. Or at the most, it can be a preventable, like when you use a mask, the exposure to the dust can be reduced and the sneezing reflexes can be controlled. Or when you know that there is a specific substance which triggers the sneezing, then that substance has to be avoided, and by that it can be cured. But once it results in an inflammation of the nasal mucosa and there is a postnasal drip continuing, then it cannot be just treated with the prevention of the factor. Now, the same is applicable to the Kriya Kala in the in the early stages, prevention of these triggering causes can be enough to manage, but once it results in the next stage, it requires a specific treatment. And a good number of patients who come to you would be presenting with this kind of sneezing activity where there will be postnasal drip. Now, once that postnasal drip starts in as a presentation, the patients would have a sort of periodicity of these sneezing reflexes. They will be always more in the early morning hours, or whenever there is a movement of the head, that sneezing reflexes could occur, or any sort of simple stimulus can produce a bout of sneezing, and the bout of sneezing doesn't end in clearance. It can be persistent sneezing, and that kind of a sneezing reflex is one of the common causes which we see. And in that condition, if you do a thorough clinical examination, you can see that evidences of the sign, this inflammation in the nasal mucosa and the nasal postnasal drip also can be identified if you use a specific tool to look at the pharynx, which may not be generally required. If you look at with the endoscope, these discharges can be seen, inflammation and X-rays can be seen. In this condition, the treatment could be simple. In our medical treatment, which I would just suggest would be Mrityunjaya Laghusul Shekaravati could be enough, or many times a simple mechanical treatment of the removal of the discharges by maybe Jalaneti, such protocols where the cost could be reduced. Even simple pranayama can help in preventing the conditions as such. And of course, prevention of the triggering causes like the hypersensitivity factors also have to be avoided. That's one of the important part of it. And majority of these conditions can be cured. But a persistent sneezing also can occur occasionally if there is an abnormality of the central nervous system, the sneezing center which becomes abnormal. In that condition, the sneezing will not have the periodicity. It will occur anytime, and there will be very severe persistent episodes. Comparatively, that kind of a situation is rare, and that cannot be treated with the same Mrityunjaya SOT, but it requires assessment in terms of the MRI scanning and look at the possibility of any structural abnormality. But luckily, such conditions are extremely rare. Majority of the patients whom we see would be of this sort, where there could be the postnasal drip as a cause. Now, a similar situation which is involving the nasal mucosa could be due to an inflammatory pathology of the nasal mucosa, something which is something like the pittaja or vatakaphaja vyadhi. Now, which is also named as pratishaya. Pratishaya is chayam gataha murdhani marutadaya pratak samastasya tathaiva shonitam prakopyamanaha vividhi prakopanihi nranam pratishaya karaha bhavanti. Pratishaya is produced due to some inflammatory pathology, extraneous causes. Again, now we consider virus as the causes as such. Maybe according to Sushila, it's due to the vitiated doshas which are accumulated, and it involves the doshas either Vataja, Pittaja, Kaphaja alone, or even the Rakta. So this Pratishaya could be presented in the 5 varieties of the Pratishaya. The majority of the conditions which we see in the clinical practice are Vata Kaphaja variety, where there could be low grade fever and the sneezing could occur. But more than sneezing, there will be the more of nasal irritation. There could be irritation in the nose, which is generally common cold-like condition. You may have the other systemic symptoms like mild headache and so on. And this is one of the possible srotovaigunya of the Pranavaha srotas, the nose as such, one of the components of the Pranavaha srotas. And these conditions can be easily diagnosed. The simple, if you look at the nasal mucosa, you will see that nasal mucosa has spots of some exudative inflammation sticking over the area and spots of inflammation. These kinds of appearance is very common there, and the duration is short. And majority of these conditions can be managed without specific medication. Simple, keeping the patient warm, reducing the exercise, taking care in the diet, with the concept of treatment of the Kaphaja Dwara would be enough. Suppose if it cannot be managed, or Mrityunjaya Aragya Amrita for 1 or 2 days, short duration would be enough. The same features can be considered as kapha if the same are persisting for a slightly longer duration, something like 3 or 4 days, where the patient would have more systemic symptoms like gauravam, shidam utvesha, romaharsho, adinitrata, sroto rodo rugalputvam, praseko, madhurasyata, natyushnagata, chardihi, angasado, vipakata, pradishaya, aruchihi, kasaha, kapajay, akshnoscha, shuklata. Pradishaya, that discharges would be there. Along with that, if the patient has more systemic symptoms like the pain in the body, heaviness, or degree of fever is slightly higher, then it can be considered as kapha, which also involves the Pranavaha srotas, though in the list of diseases involving the Pranavaha srotas, kapha is not mentioned. Again, the treatment protocol would be the same, Mrityunjaya Arogyardhini Amritarishta, but the duration of the treatment may have to be enhanced up to about a week, 4 or 5 days, or 1 week may be required. So that's how it has to be assessed clinically. Now, rhinitis, the same this inflammatory pathology, that itself can result in progression further, and it can present as the complication, postnasal drip. Now, the postnasal drip produced as a result of allergic phenomena, where it only when the exposure due to persistent exposure postnasal drip occurs is something different, whereas in the conditions where the rhinitis results in that inflammatory pathology like the viral or maybe the bacterial inflammation, that results in the postnasal drip, there will be more of exudates in the anterior component also. The nasal mucosa will be inflamed. If you look at the nasal mucosa, it will be very clearly seen there will be reddish discoloration, and the discharges will be somewhat watery, somewhat thicker than what we see in the simple allergic phenomena. And along with that, the patient would have the other symptoms, systemic symptoms like headache or the pain throughout the body and so on. That's what is mentioned in case as a upadrava of pratishaya, shirogurutvam, shavatoh pravartanam, tata angamartaha, parihistaro mata, upadravasya apare, prutak vidaha, nranam pratishaya purasvaraha. These pratishaya purasvara, which I would consider as a pitta kaphaja vyadhi, and the treatment again would be same, Mrityunjaya Arogyardhini Amritarishta. The duration of the treatment may be enhanced. It's not the Lagusut Shekaravati, there the Amritarishta Arogyardhini, the same treatment has given. Duration of the treatment may have to be enhanced further. And that postnasal drip produced due to viral pathology is something comparatively easier. Whereas the allergic rhinitis, that would be presented as repeated episodes. Now, allergic rhinitis is again a rhinitis where the inflammation of the nasal mucosa occurs, but unlike that of the viral inflammation, there would not be much reddish color. And the history would be, there would be recurrent episodes. Bhutva pratishayo akasmad vinivartate sampako apako va sarva prabhava smrita linganchaya sarvesham pinasanam cha sarvade. It can result in repeated episodes, and the patient may have persistent symptoms, then it is called as pinasa, and there may be either more discharges or lesser discharges. Or it also could be seen in case of the kaphaja variety, when the same allergic rhinitis persists for a longer duration, it is the pinasa tridoshaja. Whereas in a shorter duration, if the patient comes within a short duration of 1 or 2 months in that condition, it would be a kapha krute granat shukla shita sravenmuhu shuklavabhasa shunaksho bhaved guru shiromkha shira galavastatalu kandu yanamati vacha. Back there could be more of itching around the area and the discharges are somewhat thicker, then it's a kaphaja variety of the pratishaya. Or when the patient would have more watery discharge, these are all the manifestations of the allergic rhinitis, and continuous discharges over there, more at the night time, then it's considered as a nasa paristrava, one of the nasagata vyadhi. Ajasram acham salila prakasham yasya avivaranam srotihanaha nasa ratro visheshana hitam vikaram nasa paristravam iti vayasyet. And in that allergic rhinitis, the typical would be the nasal mucosa seems to be somewhat bulged, like the fluid accumulation would be somewhat submucous. Discharges are seen to be adherent to the surface, and the whole surface would be shining. Appearance would be shining due to that adherence of the watery discharges over the area, and this appearance is very characteristic with the history. In that condition, the duration of the treatment would be longer, and the management also may have to be modified according to the duration or maybe the complications. The outcome would be much lesser, much poorer than simply an inflammatory rhinitis like viral rhinitis. The duration of the treatment may have to be 3 months and may would prefer Mrityunjarasya, Lagusumshekara, Amritarisha and Anutelanasya. And if still it doesn't yield to that, then it could be like in a Tridoshaja Vyadhi where it's persisting for long duration, Virechana or Vamana could be tried. In Kaphaja Vyadhi, Haridra Khanda, Chavanaprasha also could be suggested as a to prevention. And in the when it results in Nasa Parishrava Lakshana, where there is a persistent discharge over the area, and the patient also has some trend for the atrophic changes, then Makarudvaja can be given as 1 week. Now, certain of the other changes which can occur, if the same, any of these can persist for a longer duration, it results in the Sroto Vaikunya. A dosha Vaikunya results in the Sroto Vaikunya. And one of the possible changes could be, there could be atrophic changes. And in the atrophic changes occurs, it results in the nasal cavity become widened. There could be greenish crust. The foul odor can be presented over the area. And progressive changes, the nasal mucosa can become atrophied. Turbinae also can become somewhat hypertrophied. The patient, even if the lumen is open, patient may not be able to take the air in, and that's what calls a paradoxical nasal obstruction. And the patient may have even changes in the smell sensation. And that's exactly what's mentioned as the nasanaha. Anashyate yasya vidupyate ja praklidhyate shushyate chapi nasa navetti cho gandharasamshyandhu justam vyavasyetam apinasena, that's apinasa or nasa pratinaha. Tamcha anilashkreshna bhumikaram bhuyat pratishyaya samanalingam. That atrophic rhinitis makes it more complicated and the treatment would be very difficult. The same, the Nasa Anaha also is discussed in the, or Dusha Pratishyaya also is the other description, where Praklidhyati Punarnasa Punascha Parishushati Muhu Anashyate Japi Muhur Vivijate Tata Nishwasochas Durgandimtra Gandhana Betija Evam Dusha Pratishyayam Janiyat Pritsasadhanam, it's a Pritsasadhya. Poor prognosis. Once the atrophic changes occurs, the poor prognosis, and my usual prescription would be Mrityunjarasya, Suchekara, Godantya, Patikara Churna for a long duration. Virechana also could be tried. Anutelanasya, of course, it could not, it's not written. Anutelanasya also could be one of the measures which could be helpful in this condition to manage. It's not that the condition can be cured. Once the atrophic changes occurs, it becomes somewhat irreversible. Atrophic changes also can present with the severe this denudation, where the whole surface nasal mucosa can become somewhat slumpy, irregular, very rough, and these conditions are practically incurable. And even with the surgical treatment, treatment is almost not possible. And that's exactly Nasa Parishosha. Granashrite Shishmani Martena Pittena Gadam Parishoshileja. Samutshasiti Urdham Adhishta Kritsab Yaha Tasya Nasa Parishosha, where the patient would have a difficulty in breathing, and that condition is almost incurable. That's about one possible course of the one example of that Sroto Drushti. If you feel that, we will continue in the next session further about that. So if there are any questions, I will try to have that, and then we will continue next. We will wind up today. So, right. No questions. I will wind up today.
Thank you, sir.